for 3 middle toes and 1 for the 5th toe. The interosseous muscles arise from the shafts of the metatarsals and insert into the bases of the proximal phalanges. The action of the interosseous muscles is to flex the toes at the MP joints. Now we'll look at the middle group of muscles. These are all closely associated with the tendon of flexor digitorum longus. The middle group consists of the tiny lumbrical muscles, flexor accessorius, and, superficial to them, flexor digitorum brevis, which we'll see again in a moment. The 4 lumbricals are just like the lumbricals in the hand. We won't look at them in detail. Flexor accessorius, also called quadratus plantae, arises by 2 heads from here and here on the calcaneus. Flexor accessorius inserts here into the deep aspect of the tendon of flexor digitorum longus. Flexor accessorius aids in flexing the toes. Now we'll add flexor digitorum brevis to the picture. Here it is again. Flexor digitorum brevis arises from here on the calcaneus. Flexor digitorum brevis divides to form 4 tendons. Each of these enters one of the tendon sheaths, along with a tendon of flexor digitorum longus. Inside the tendon sheath, which we'll remove, the brevis tendon splits into 2 halves, which encircle the longus tendon. Flexor digitorum brevis inserts here on the bases of the middle phalanges. Flexor digitorum brevis assists in producing flexion at the PIP and MP joints. Lying superficial to flexor digitorum brevis is the plantar aponeurosis, which we've looked at already. Now we'll look at the muscles for the big toe. To build up a picture of them, we'll first take the middle group of muscles out of the picture so that we're again looking at just the interossei. The muscles for the big toe are flexor hallucis brevis, adductor hallucis, and abductor hallucis. We'll look at them in that order. Flexor hallucis brevis has 2 almost distinct parts, which arise here from the cuboid and 3rd cuneiform bones. Flexor hallucis brevis gives rise to 2 tendons of insertion, which attach first to the medial and lateral sesamoid bones, then to the base of the proximal phalanx of the big toe. The tendon of flexor hallucis longus, which we'll add to the picture for a moment, runs between the 2 halves of flexor hallucis brevis. Here's adductor hallucis. It arises by 2 heads, an oblique head and a transverse head. The oblique head arises from the bases of the middle 3 metatarsals. The transverse head arises from the deep transverse metatarsal ligament. These 2 heads converge and merge with the medial head of flexor hallucis brevis, sharing its insertion on the medial sesamoid bone and on the base of the proximal phalanx. Medial to flexor hallucis brevis is abductor hallucis. Abductor hallucis is the most medial of all the foot muscles. It arises here, on the medial side of the calcaneus. The tendon of abductor hallucis merges with the medial part of flexor hallucis brevis and inserts with it here, on the medial sesamoid bone and on the base of the proximal phalanx. The main action of all 3 of the short muscles of the big toe is to produce flexion at the MP joint. In addition, adductor and abductor hallucis brevis can produce adduction and abduction of the big toe. Lastly, there are 2 short muscles for the 5th toe. a short flexor, and an abductor. Here's the flexor, flexor digiti minimi brevis. It's an outlying interosseous muscle that's been given a long name. Here's the abductor, abductor digiti minimi. It arises all the way back here on the calcaneus. It's inserted here on the proximal phalanx of the fifth toe. Now that we've seen the muscles for the big toe and the fifth toe, we need to see how all these short muscles fit together. To do that, we'll put the long flexor tendons and then the central group of muscles back into the picture. First, we'll add flexor hallucis longus to the picture. Flexor hallucis longus lies deep to abductor hallucis as it enters the foot. Here's flexor digitorum longus, entering the foot along with flexor hallucis longus. The tendons of flexor digitorum longus cover up adductor hallucis. Here are the lumbar